Listen to your body, not arbitrary schedules. Most healthy men after 60 find 2 to 4 times per week optimal, but your individual needs matter more than any universal rule. Focus on quality over quantity and adjust based on energy levels, health conditions, and personal satisfaction. Your body sets the schedule, not society. The most important truth about masturbation frequency after 60 is that your body becomes your best guide. Unlike younger years, when hormones might drive daily or multiple daily sessions, your mature body operates on a more refined rhythm. This isn't a decline, it's an evolution toward more intentional, satisfying experiences. Your testosterone levels naturally shift, but this doesn't mean desire disappears. Instead, it transforms into something more sustainable and often more emotionally fulfilling. Pay attention to your natural urges rather than forcing artificial schedules. Some men find they crave release every other day, others once or twice weekly, and some prefer longer intervals. Your body will signal when it's ready through increased interest, morning erections, or general sexual awareness. These natural cues are far more reliable than any expert's recommendation because they reflect your unique physiology, stress levels, and overall health status. The sweet spot, 2 to 4 times per week. Research suggests that most men over 60 find their optimal frequency falls between 2 to 4 times per week. This range allows for adequate recovery time while maintaining sexual function and hormonal balance. However, this is a starting point, not a rigid prescription. Your ideal frequency depends on multiple factors, including overall health, medication effects, stress levels, relationship status, and personal preferences. 3 times per week often emerges as a comfortable rhythm for many men. This frequency supports prostate health, maintains erectile function, and provides stress relief without causing fatigue or performance anxiety. It's frequent enough to keep sexual responses active, but spaced enough to allow full recovery and anticipation. This schedule also accommodates the natural ebb and flow of desire that many men experience as they age. Health conditions and frequency adjustments. Your medical conditions significantly influence optimal frequency. Men with diabetes might need to adjust based on blood sugar stability and energy levels. Those with cardiovascular issues should monitor how sexual activity affects their heart rate and recovery time. Blood pressure medications, antidepressants, and prostate medications can all impact libido and erectile function, requiring frequency adjustments. If you're dealing with prostate issues, regular ejaculation actually supports prostate health by clearing out potentially harmful substances. Studies suggest that men who ejaculate 21 times per month have lower prostate cancer risk, but this doesn't mean you need daily sessions. Quality matters more than hitting specific numbers, and your comfort level should guide decisions more than statistical averages. Recovery time becomes more important after 60. While younger men might recover within hours, you might need 24 to 48 hours between sessions for optimal satisfaction. This isn't a failure. It's your body's way of ensuring each experience is fully satisfying rather than rushed or forced. Respect this natural rhythm rather than fighting it. Quality over quantity principles. As you age, shifting focus from frequency to quality dramatically improves satisfaction. Longer sessions with more foreplay, different techniques, and mindful attention to sensation often prove more fulfilling than quick, frequent releases. Your body responds better to patient, varied stimulation than repetitive, rushed approaches. Consider extending your sessions to 20 to 30 minutes rather than rushing to climax. This allows your body to fully respond and increases the intensity of eventual orgasm. Use this time to explore different touches, pressures, and rhythms. Your sensitivity might change with age, but this often means discovering new preferences rather than losing pleasure. Mental engagement becomes increasingly important. Fantasy, relaxation, and emotional connection to the experience enhance physical sensation. Many men find that mindful masturbation, focusing fully on physical sensations and emotional responses, provides deeper satisfaction than distracted or routine sessions. Relationship status and frequency. Your relationship status significantly impacts optimal masturbation frequency. Single men often find that regular self-pleasure provides essential sexual outlet and stress relief. Without a partner, masturbation becomes primary sexual expression, potentially supporting higher frequency within comfort limits. Married or partnered men need to balance masturbation with couple intimacy. Some couples find that individual sexual expression enhances their shared intimacy, while others prefer focusing energy on partnered activities. Open communication about needs and preferences prevents misunderstandings and supports both individual and couple satisfaction. Long-term relationships sometimes experience periods where partners' libidos don't align. During these times, masturbation can provide individual satisfaction without pressuring partners. This isn't selfish. It's mature recognition that sexual needs don't always synchronize perfectly, and individual fulfillment supports relationship health. Energy levels and timing. Your energy patterns change significantly after 60, affecting optimal timing for sexual activity. Many men find morning sessions more satisfying when testosterone levels peak naturally. Others prefer evening sessions as stress relief after daily activities. Pay attention to when you feel most energetic and interested, rather than forcing sessions during low energy periods. Fatigue affects sexual satisfaction more dramatically as you age. Attempting masturbation when exhausted often leads to disappointing experiences and can create negative associations with sexual activity. Instead, choose times when you feel alert and relaxed. Even if this means less frequent sessions, consider your weekly schedule when planning frequency. High-stress periods might call for more frequent stress relief, while busy times might naturally reduce sexual activity. This flexibility prevents sexual expression from becoming another source of pressure or obligation. Signs you're finding your rhythm. Several indicators suggest you found your optimal frequency. First, you look forward to sexual activity rather than viewing it as obligation or routine. Second, you feel satisfied and relaxed afterward rather than depleted or anxious. Third, your overall mood and energy levels remain stable or improve with your chosen frequency. Physical indicators include maintaining erectile function, experiencing satisfying orgasms, and feeling comfortable recovery periods. If you're struggling with erections or orgasms feel forced or unsatisfying, you might need to adjust frequency, technique, or timing. Emotional well-being provides another important measure. Optimal frequency supports confidence, reduces stress, and maintains connection to your sexual identity. If masturbation increases anxiety, shame, or relationship problems, reassess your approach rather than abandoning sexual expression entirely. Adapting as you age further. Your optimal frequency will likely continue evolving as you age. What works at 60 might need adjustment at 70 or 80. This isn't decline. It's continued adaptation to your changing body and life circumstances. Stay flexible and responsive to your body signals rather than clinging to previous patterns. Regular self-assessment helps maintain optimal frequency. Monthly check-ins about satisfaction, energy levels, and overall well-being can guide adjustments. Remember that temporary changes due to stress, illness, or life transitions are normal and don't require permanent frequency changes. The key is maintaining sexual wellness as part of overall health rather than viewing it as separate from or less important than other aspects of aging. Your sexual frequency after 60 should support your overall well-being, energy levels, and life satisfaction rather than creating additional stress or pressure.